Hey clinicians, how's it going today? We have a really fun topic today. It got really spicy in all the comments and people sharing what opinions and comments really kind of trigger them a bit in practice. So we're going to be talking about that today. And yeah, I think this is a really important topic. Of course, because I'm a chiropractor, a lot of my audience is also are also chiropractors, and so there tends to be a lot of chiropractic specific stuff, which we'll definitely go into. But of course, I have people from other professions and other professions within healthcare and outside of healthcare. So yeah, we're going to be kind of diving into more generally how we kind of can think about negative comments or opinions or things that trigger us in practice. And then also some of the specific ones that I got from you guys. Thank you for contributing those. It really helps to know like what are you struggling with when it comes to this stuff. And yeah, so we got some really awesome things. And yeah, these are the kinds of things that we also talk about in our clinician gatherings. So if you are a woman in healthcare and you want to join our clinician gatherings, I will put a little link in this live to let you know more about that. But this is the kind of stuff you can bring to that, right? Like something happened in practice, I felt really emotionally triggered by it. Either it really upset me, it made me feel sad, it made me feel angry, it made me feel like I want to leave the profession, whatever it is. That's the space that you can come and talk about that stuff, because we all struggle with that. And it can be so helpful to hear that you're not the only person struggling with that. And then just also hearing, how other people deal with it or see it can be really helpful. So let me know if you're keen to join that and I'll give you the details, but I'll also put the link in the comments. So for those of you who don't know me, I'm Sarah, health and career coach for women clinicians. And we're going to be talking about this in the context of both career fulfillment and then also just our health, right? Because in general, when we are dealing with this and we're upset by things and things trigger us, it also triggers our stress response, of course, right? So we have like these chronic stresses from other people's judgments and opinions, etc. And then we also can have, which you'll see in a lot of the comments that people made, is a lot of people will then use those comments and those opinions as like reasons why they don't want to do that job anymore or want to consider a career change, right? So these are things that I'm often helping clinicians with. And I like to always say, I'm neutral about what decision you make. Like if you decide to go and do another career or you decide to stay in your career or whatever it is, I'm neutral about the details of the decision itself. But what I want to know is what is the place that that is coming from. And this is one of those examples, right? We don't want to be making career choices from the place of I'm trying to avoid people's negative opinions or comments about me, right? So just looking at like, where does this discomfort come from? And just exploring that a little bit further. So when we talk about dealing with these, what I call like crappy comments, when we talk about dealing with them, what we don't mean, or what I don't mean by that, is how do we make them stop happening, right? Because that's usually what we would like. Is like, how can I make people stop judging me, stop disrespecting me, stop making these types of comments, whatever it is. We're not trying to control other people's behavior. And just think about it. If you're waiting for other people to change before you're happy, before you're successful, before you're fulfilled, before you have joy and, ease and lack of stress, like if you're waiting on other people to change before that happens, like you're going to be waiting a long time. And it's just, why would you put something so important like your own health and fulfillment? Why would you put that in the hands of other people who don't necessarily have your best interests at heart? We'll go into that a little bit later. But are not necessarily thinking about what's best for you, right? So you need to be the person prioritizing that health and career fulfillment and not relying on other people to accept what you do and respect what you do and understand what you do before you have that. So that being said, I know it is incredibly hard when you're dealing with, especially a profession that has a kind of general, like people's general view on it is quite negative. Like I understand that, I have been there, am there. So just knowing it is really hard, right? So we're not denying that it's difficult. We're not denying that we're struggling. We're not denying that it emotionally is affecting us, but we're also not using it as the thing that's controlling our life. Like one of my coaches used to use the analogy of caring what other people think and about their judgments and opinions and comments and all of that. Like we have that as a passenger, right? And that's okay. Like that thing is going to probably follow us along with most of our life, and that's fine. But don't put it in the driver's seat, right? Like just let it be in the passenger seat, coming with you on the ride, but not directing where your life goes, what decisions you make, and all of that. Okay, so we are both accepting the reality that we are going to have to deal with these kinds of comments, and we're also accepting the reality that it affects us and it can be really hard. And both are true, right? So thinking about like you are wired for acceptance and being in a social group and not feeling rejected, like that's what we're wired for. So it is really physically and psychologically uncomfortable when we feel like we are rejected in some way, and just realizing that that is hard for you and showing up for yourself as someone who is comforting someone who is struggling with something, right? Like if your friend was rejected by someone, how would you show up for that friend in the same way, right? So being that person for yourself as well. Okay, so the other thing that I wanted to just touch on with that, and I'm calling some clinicians out, including myself, like this is what I did 100%. One of the very common complaints from clinicians or annoyances with their patients is patients who don't take responsibility for their own health, are like a victim. They have that like victim mindset. They blame everything on everybody else, right? So it's a very common trigger for clinicians. And I want to just point out that when we are blaming everybody else for why we are not successful, not happy, not fulfilled, we are doing the same thing, right? So taking back that control and that responsibility, and not doing the very thing that frustrates us so much about our own patients, right? And just noticing that, like lovingly, it doesn't have to be like judging ourselves for that, but just noticing we also do that. We just do it in different situations. Okay, so that out of the way. So that is not, so dealing with it does not mean denying the reality that it exists and trying to control other people's behavior. What it does mean is that we're using that trigger or that thing that upset you, and we're using it to explore what it meant for you. We're exploring it as something that helps us with self-awareness, and we are using it as something that changes how we show up, changes how we deal with those comments in the future. It's professional and personal growth, right? Like you are learning the skill of navigating other people's comments about you, of navigating people being wrong about you, okay? One of the examples I wanted to share is when I started coaching, I was in this group of physicians who were transitioning to a career in coaching. And the main concern for all these physicians was people are going to be so judgmental of me for going from being a doctor to being a coach, right? And I was like, oh, I've already dealt with that, right? Like I've been a chiropractor, I've dealt with the opinions that people have of me, the misconceptions, all of that. So I was like, oh, this is so cool to notice. Like I already have that skill of navigating that and not letting that dictate my life's decisions, etc., because I had to work through a lot of that in my journey. And so just realizing like that is a skill that is helpful in every area of your life, right? If you are using other people's judgments and opinions of you as what is dictating your actions and your decisions, you are not only doing that in your career. I can promise you that, right? You're likely doing that in other areas as well. And it's so important for us to learn to be what they call like self-authored in our lives and in our careers, and that we are the ones authoring that we are the ones making the decision, and not just being sort of swayed around by whatever other people think of us and whatever misconceptions they have, etc. Okay, so we are exploring it a little bit deeper, and we are using it as something that can actually develop us, that can make us stronger, that can make us grow, right? Okay, so in general, this is more sort of a general thing, and then I'll go into specific examples. But as a general thing, when someone says something that triggers you, that upsets you, that stresses you out, right? These are some of the things you can reflect on. The first one is, what are you making that comment mean? Okay, so I'll share an example. There'll be a few examples around this, as I've dealt with a lot of these comments. But there was one of my patients, she asked me how many like CPD points we have to get, right? And when I told her, she was shocked, and she was like, how many techniques are there? Like, how much CPD do you actually have to do? And I was so triggered by this comment because, sorry, I'm just seeing the autocorrect is saying CBD instead of CPD. Anyway, so like, how much CPD do you have to do? And I made this mean that she thought that my profession was, not respectable. It was a profession that clearly doesn't, like, you just learn a few techniques and that's it. Like, where else do you have to grow, right? I was making it mean so many things about her opinions on what I do. And just reflecting on that, like, she is a return patient, right? She comes back, she sends all her family members to me. Like, clearly she doesn't disrespect me, but that is what I took from what she was saying, right? So what do you mean making that comment mean about maybe what they're saying about you? Or what are you making it mean about them? Like, they're disrespectful, or they are ignorant, or they are whatever it is, right? And what are you making it mean about your profession, right? So this was something that I also, it was actually quite cool. I could explore this with my coach at the time. So I took this particular situation and I said, this is what really upset me. And she was saying, like, another response is just like laughing it off and being like, this lady has no idea. Like, of course she doesn't. She has no idea what subjects I did, or what our studies entail, how long it is. This is similar to like when you tell people how long you studied and they're like so shocked. People get so triggered by that. Like, you could just have a sense of like, of course they have no idea. Like, they're not in that profession. Why would they know this stuff? And it doesn't have to mean anything bad about me or my profession or whatever. So anyway, in this, what we sort of saw is when I was triggered by this is the times that I would go and research other careers. So I was making it mean something about my career, and I was essentially agreeing with her, like, yes, you're right, this is a disrespect, like a career that shouldn't be respected, and I should do something else, like almost diving into that with her, instead of like coming up for myself or just being like, of course, yeah, she has no idea. Why would she, right? So the general question of like, what are you making it mean? Whether that's you making it mean something about them, about you, about your profession, what are you making it mean? Another thing you can reflect on is, imagine another clinician heard the exact same thing and they weren't triggered by it. They did not have the emotional reaction to it. They didn't have the stress reaction to it. What do you think they believe that you don't? What other, like, if that patient says, for example, in this scenario, how many years did you study? And then you tell them and they're like, why does it take you that long to study this thing, right? Like, how much can there actually be to learn in your profession, right? And just thinking about like, if another clinician had heard that and they like said, maybe, for example, what does she know type thing. What different thoughts do you think they have in their brain? Like I sometimes say, like thoughts are just like sentences that appear in your brain, right? In my brain, it was going, she doesn't respect my career. She doesn't think that what I did was hard, or I didn't need to be smart in order to do this. Those are the sentences coming up in my brain. What sentences do you think are coming up in someone's brain who isn't emotionally triggered or affected by it, right? And then reflections on your thought and essentially what that leads to. So, for example, in my case, those thoughts led to me being annoyed. It led to me searching for, other careers and researching other careers and looking into other options. So essentially what I'm doing is I'm reinforcing it because I'm essentially agreeing with her stance on my career. I'm saying, yeah, this is crap. I'm gonna go do something else, right? Sometimes it's like agreeing with them. Sometimes it's reflecting the exact same judgment on them, right? Like this is one of the examples with my patients. I would get really frustrated when they are interrupting me. And my thought was, they don't listen to me, or they're not listening to me, and that's disrespectful, etc. Right? When I'm so in my head and I'm annoyed and I'm like going on about how can this person do this, right? Guess what I am doing? I'm not listening to them, right? So often there's this reflection that we are doing the exact same thing that we are frustrated with the other person about doing it. So, for example, when another professional is judging you and disrespecting you, you go on this whole thought train, this whole emotional train, being triggered, getting, like resentful and all these kinds of things. And you having all these thoughts that are also judgmental about that person and disrespectful about that person. They don't even know what they're doing. They don't even bother to learn about my profession, etc., right? So seeing where the things are reflected, like exactly what you think of that person, or exactly what you think they think of you, you're thinking of them, or you're reinforcing the same thing. So for example, if you, this is an example for me. So I would assume that another healthcare professional is not going to respect what I do, right? So when I am meeting someone who's in healthcare, I either would not tell them what I do, or if I tell them what I would do, I would not engage in any discussions about that. I would like kind of, change the topic or whatever it is. Because so essentially I'm reinforcing that same thing because I'm assuming that they are not respecting my profession and that they don't understand my profession. But guess what? When I don't talk to them about what I do, or show them that I know things, or get them to ask questions, I'm not helping the situation of them not knowing or understanding or respecting what I do, right? So I'm reinforcing that exact same thing that I was afraid of. Okay, so we're going to go into a few more like specifics. And the 3 general categories I gave in the Facebook group for voting was, struggling with comments from your patients, struggling with comments from other healthcare providers, and then people in your practice. And generally people chose patients or other healthcare providers. Usually if there is someone in the practice, it's usually can fall under that sort of general thing of general comments, right? Sometimes it's like specific to they also don't respect me, or they think I'm lazy, or whatever it is. But it's less kind of specific. We don't get specific things necessarily from colleagues. That's usually based on our relationship with them, how the practice runs, etc. So I'd have to know a little bit more detail about like what was the colleague's comment that annoyed you or triggered you or made you mad or whatever. Whereas like there are kind of consistent things that patients do and say, and other healthcare providers that I will go into now. Okay, let me just take some water. I'd love to know your your ones, by the way. We did get, like I said, a few comments and people sharing their stories, but I'd love to know yours and if there's almost like a consistent thing that tends to trigger you in practice. as we often do see patterns. And that's why I said it can be so helpful to explore that, because you get to learn so much more about you, especially that question of like, what am I making this mean about me? We can often see an identity that we don't want to have, right? Like, for example, with me, one of my unwanted identities is that I'm not smart. So, you know, this is like part of that whole thing of like when you growing up and everyone tells you you're smart, you almost see that as like, that's a really important thing to be. And anything less than that is somehow bad, right? So any comment that someone makes that triggers me to think, oh, they think I'm not smart, that is a very common theme in things that trigger me. So then I can start to look at like, oh, that's so interesting that I believe that being smart is somehow this like, you know, the most important thing. And just, yeah, you get to explore why that's triggering. And I often say, when we are emotionally triggered, it tells us way more about ourselves than about the other person. So if you use that as something that tells you something about yourself, it can be really helpful. And also it tells us a lot about our sort of default ways of handling things, which I'll go into now. So I'm going to start with the, situations in practice. So for me, particularly in the early days, patients will make sexist comments, comments about your size, comments about the profession, whatever it is, right? They would also often make racist comments, not towards me, but assuming that because I'm white, I would agree with their racist comments, right? And I remember in my early days in practice, my main thing was I don't want to make my patient feel uncomfortable, which is so ironic because they're making me uncomfortable, right? And yeah, it was very much that kind of people pleasing and like the patient is always right and the patient must always be comfortable. And so I would never speak up when someone says something. I would never, have that awkward moment where I say like, that's unacceptable. I don't want comments like that or whatever it is, like I won't have someone talking to me like that. So just noticing your default patterns. Do you generally get defensive? Do you generally keep quiet and rage inside, right? What is your general kind of approach or response? And that also teaches you so much about you. Because one of the things I think, just on that thing about people making inappropriate comments, I think one of the things that people can often misunderstand is that when I'm saying, it says more about you, or, it's about how you deal with it, that we then have to just, like sit back and like have people make inappropriate comments towards us, or like not hold people accountable and just work on ourselves, and that's not the case. Like, I believe we need to be setting boundaries. We need to be holding people accountable for their bad behavior. We need to be talking about things that are important and that things that need to change, and we need to start taking action. We need to be contributing to larger change within our profession, within our world, right? Like, all of those things are incredibly important. It's more the comment of, we can't control what that other person does. We can set a boundary. We can stand up for ourselves. We can, take action towards bigger change, get involved in our professional association to further our profession, right? All of those things. But we're not going to wait for that to be happy, or wait for that to be fulfilled, or wait for that to make us successful. So just clarifying that as well. Okay, so yeah, things like, racist comments, sexist comments, sizist comments, we don't have to be just accepting when patients do that. And we don't have to make them feel comfortable when they are making us feel uncomfortable. We don't have to see those patients when they are making inappropriate comments. You get to decide who you're seeing, and you get to put boundaries around how you are willing to be treated and how you're not willing to be treated. So we are looking at what are we making it mean, but we also are being very firm in our boundaries. Okay, so yeah, so that point was kind of similar, with patients as well. We can go into what are we making this comment mean? What would another clinician who had the exact same patient, who made the exact same comment, what do they believe what do they believe or what are they thinking when they are not triggered by that? The other example that people used in patients is, the general like disrespect of the profession, which they interpret through actions like they want things at a lower cost, right? Maybe they ask for a discount or they want results immediately. So this is an example of when we are making those things mean that the person doesn't respect us or that the person, thinks our profession is just, whatever. So just think about like, why would that mean those things? And just explore that for yourself, right? Like if someone wants to have something at a lower cost, does that necessarily mean that they are disrespecting you? And this is an example of where we can be quite clear, like, no, I don't give discounts. And that can be the end of it. It doesn't have to be this thing that like triggers us and makes us like make judgments about them or about us or whatever it is. Like people spending on other things, but not our care, right? What are you making that mean about them as a person, right? Are you making it mean that they, don't value what you do? Are you making it mean that they don't have their priorities straight and that they should live differently, right? Like just exploring that a little bit. And, for example, patients wanting results immediately. So think about, for example, this is, more the case, for example, with physiotherapists or chiropractors, right? We have multiple treatments to help someone with something. And think about on the other end of that scale, right? If you go to a medical doctor, you don't expect to keep coming back for a couple of weeks, right? That's just not what you expect. So why are we so offended when a patient doesn't expect that from our care, when they don't know anything about how we work, right? We know that very well, but they don't necessarily know that well. On the other spectrum of that, right? Like think about a therapist, like a psychotherapist, right? Generally, you keep going to your psychotherapist. You don't go like, okay, this is the amount of sessions we're doing, and then we're done. Or to deal with this specific problem, we're going to give it this many sessions, right? Whereas a patient might really expect that. They'll say, like, tell me how many sessions it's going to take for me to like, get over my childhood trauma, whatever it is, right? So thinking of the other end of that spectrum and realizing that patients will have their own expectations. Patients will have their own desires. Patients will try and get away with this or that. It doesn't have to mean anything about us or our profession or them or anything like that. Okay. And it also doesn't have to mean that you have to do anything specific. So, for example, if a patient asks you for a discount, it doesn't mean, oh, well, now I have to give them a discount. No, of course it doesn't mean that, right? You can have your own actions and procedures and whatever, regardless of what the patient expects or doesn't expect or thinks can happen or doesn't think can happen, right? It doesn't have to mean anything for whatever you do as a result of that. And then the other big category that, like I said, particularly people in a career like chiropractic, where you perceive this very like, this general societal view on your profession is quite negative. And I struggled a lot with this, so I totally understand that. But I just want to open you up to the idea that most professions have their version of this. So I coach people from other careers in healthcare, not just chiropractic, and they all have a similar version of this. It might be slightly different what exactly it is, but everyone has their version of this. I also coach people who are not in healthcare, and they have the same thing, right? In that same, when I was coaching with that client who made the comments about like how much CPD would you need, there was also a lawyer in that group, and she said, I get the exact same comments. People don't understand why I had to study so long, like how much law could there possibly be to learn, right? So every profession has these. You're not going to avoid people's judgments by switching to another profession. So that's just what I want to clear up. And that's why I say, like, I don't want that to be the driving force of you like doing something else because you think there I'm going to be protected. from other people's judgments. No, we want to learn the skill of navigating and dealing with other people's judgments so that whatever profession we're in, that is not what's guiding our decisions, right? I had one of my clients as well. She was really struggling with how her career is perceived. And that was part of her reason for leaving for another career. She also genuinely wanted to do this other career. But this is an example of where it follows along with you, right? So she, in the initial career, was really worried about what people thought of that career. And she switched to a new career. And then within this new career, there are two paths that she is considering. And one path is the one that she actually wants to do, but is less respected. People don't understand it. They've often never heard of it. And they think it's like, oh, you couldn't get into the like more prestigious one, so that's why you're doing this one. So there's all these judgments. So that difficulty with navigating those opinions and all of that is coming up again in this new career that she's following. So really be aware of the fact that it's not just in our profession. Okay, so one of the cool like thought experiments that I like to do when we are thinking this way is like, imagine someone else in a different profession decided to go back to university and study what you are doing as a profession. What do you think their reasons might be? And that can include why were they unhappy in their career and why are they pursuing your career? Like, what do they think is so awesome about your career? And what do they think is so terrible about their career? So 2 examples of this, right? I know a few physiotherapists who have later become chiropractors. And we are often saying like, oh, the physiotherapists have it so easy and they have, you know, like they have, all these patients because they get referrals and they're more well known and all of that. And the one practice that I practiced in, the physiotherapist treatments were very well covered by insurance. So we were going, you know, like, oh my gosh, you know, they get referrals from surgeons and medical doctors and all their care is like paid for. So patients go to them all the time, etc., etc. And they were frustrated because they had to answer to the insurance. They had to basically jump through all the loops of the insurance. They had less say in how they practice. They had less say in their fees, in the time of their consults, for example. And they were also frustrated by the fact that because patients didn't have to pay for their own care, they were less involved. They were less motivated to make changes, all that kind of stuff, right? So you can see how the exact same thing is seen differently by these 2 professions and why one person might decide to switch to being a physiotherapist for the exact same reason that the physiotherapist is deciding to switch to being a chiropractor. So this is just a cool like thought experiment. Another example is when I was in my early days of studying to be a chiropractor, I wanted to switch to medicine. And my reason was, again, this is going back to like, what is the source of your reason, not like the details of like whether I switched to medicine or not is irrelevant. It's more like what was the driving force behind that decision. And at that time, it was because I thought I would be able to help people more. And my sort of assumptions behind this was, if I am saving lives and basically rather helping in like life and death scenarios, then I'm helping people more. And I remember one of the seminars that I went to in chiropractic, one of the speakers said, was kind of like giving just her background. And she said, you know, she used to be an emergency medical care provider. And she got so frustrated because she felt like she was helping people at that point where it was life and death. And she really wanted to be helping people before they got to that point and not at that point. So she felt like she was helping people more by being in like more preventative or like not life and death kind of care. So just noticing like the exact same things that we might be frustrated with or we might assume about our profession, someone else is wanting to do what we do because of other assumptions and thoughts that they have. And then one of the things that I also wanted to touch on was there's a version of this, but essentially it's like, it is so unfair because we have to, you know, defend our profession and we have to be knowledgeable about XYZ and they don't have to. And what I want to make super clear is like, you're not being more knowledgeable, being, collaborative and reaching out to other professionals and, not judging them and knowing about what they do. You're not doing that to prove yourself. You're not doing that because you have to. You're doing that because that is what is best for the patient, right? If another healthcare provider doesn't do that, guess what? They are not prioritizing the patient, but that is not that's not about you, right? So just noticing where you are doing that from. Are you doing it from a place of proving yourself and feeling like you have to, and then feeling resentful that you have to do all this work, right? No, we're doing that because that makes us the best healthcare providers that we can. It makes us be able to provide the care that we want to a patient, right? So just noticing like where that comes from. Okay, the last thing that I just wanted to touch on here, I know it's been a lot. I have a lot to say on this topic if you haven't guessed. Okay, so there's a lady called Hayley McGee that I follow on Instagram, and she talks a lot about like people pleasing and stuff, which is something that clinicians struggle a lot with. We want people to like us, we want people to respect us, we want people to value us and approve of us. And she was just saying like, how do you know when to take someone else's opinion of you seriously? And so she was just going through certain questions, right? So she was saying, for example, do you respect them, right? So one of the comments that we got was, judgments by younger, like new doctors who are like not even good at what they do. They're misdiagnosing, they are, giving inappropriate treatment or whatever. Like, do you respect that practitioner? And if not, why are you using their judgments of you as anything like valuable or something that you should be directing what you do from, right? And just on that, like, how would you reach out to someone who is doing that in your own profession, right? So if you had, like, let's say you're a chiropractor, if you saw a younger chiropractor who was like very egotistical, they were like, I'm the ish, and they are misdiagnosing things and they are not treating appropriately, like you would reach out to them and you would, maybe offer to help them or, tell them something that, maybe alerts them to the fact that, oh, maybe this is not the right way to practice, or, can we set up a discussion to like talk about this? Think about how you would act in that very same situation if you were so secure in the fact that you know what you're doing is valuable, you know that you know what you're doing, all that kind of stuff. Like, how would you approach that situation very differently than like they're in another profession that is usually judgmental of mine, and so I'm sort of viewing it from that perspective, right? So anyway, back to you. So do you respect them? So when you are basing your decisions off of someone else's opinion, do you even respect that person? Are they living the kind of life that you want to be living? So looking at that aspect of it. And then the second question is, do they truly understand the situation that they are judging, right? And this is the example of the patient who like has no idea what our journey of our degree is, right? So why would we expect them to understand that? So if they don't truly understand the situation that they are judging or making a comment on, why would you take their opinions or their judgments so seriously? And then the third one is, do they have your best interests at heart? Or in this case, we could ask, do they have the patient's best interests at heart? And if not, why is their judgment important to you, right? So, and then the last one is reflecting on this similar kind of what we talked about, almost like jumping in that with them, but do you actually share their judgment, right? So when someone disrespects your profession, are you actually so triggered by it because you are also not respecting your own profession, right? When someone thinks you don't know what you're doing, is it triggering because you also actually don't believe that you know what you're doing, right? So, and that doesn't mean that it's true. It just means that sometimes we are affected by something strongly, when we actually deep down are worried about that thing as well, or judge that of ourselves as well. And usually it's just a projection of that anyway. Like we project that someone else is judging us in the way that we are actually judging ourselves, or that we are worried about being judged, not actually on the pure facts of what they are actually judging us on. Because often we don't even know. We don't even know what their opinions are. We don't know what was behind whatever their actions are. We are interpreting it through our insecurities, our beliefs, our assumptions, our worldviews, right? So these are just some things that you can reflect on when you are taking someone's opinion so to heart, and looking at kind of people-pleasing behaviors. Okay, awesome. I hope you found that helpful, and let me know your stories. And like I said, these are the kinds of things that I think are really important to discuss as clinicians, because it affects all of us in every profession, like I said, not just the one that you're in, right? So if you would like to join the clinician gatherings, we talk about stuff like this, talk about health and recovery, we talk about burnout, bore out, we talk about all these things that a lot of us as clinicians struggle with, and we talk about it in a safe space with other clinicians who really understand and who are also struggling with the same thing or have navigated that in the past and can actually help us with that. Awesome. Have a great Wednesday, and I will chat to you soon.